Chapter 2. What is xanthoma? Xanthelasma are a particular type of xanthoma. Xanthoma can appear on any part of the human body and are addressed to as xanthelasma whenever they appear on the eyelids or around the eyelids. Illustration 6. Watch the video on xanthoma. Xanthoma are fatty growths underneath the skin. These growths can appear anywhere on the body. Basically, it is a fatty growth that starts accumulating below the skin and ultimately protrudes from the surface of the skin. Xanthoma are fatty patches inside the skin. Xanthoma can vary in size. These growths may be as small as a pinhead or as large as a grape. Illustration 7. What are xanthoma video? They often look like a flat bump under the skin and sometimes appear in yellow or orange color. These are usually not painful, however, they might be tender and itchy. They can grow in clusters in the same area or several individual growths on different parts of the body. 2.1. Where can they appear? These growths can appear anywhere on the body, but they typically form on the joints, especially the knees and elbows, hands, buttocks, feet. Xanthoma may appear as single lesions or as a cluster. It may develop on one part of the body or can affect different parts. These lesions can appear in different shapes and sizes. Some people may have a xanthoma which is as large as grapes, whereas others can have xanthoma as small as a pinhead. Usually, these lesions appear as small bumps inside the skin which may be yellow or orange color. These lesions can be itchy and may be slightly tender to the touch at times. However, mostly they are not painful at all. 2.2. What are the causes? Xanthoma is usually caused by high levels of blood lipids or fats. This may be symptom of an underlying medical condition such as hyperlipidemia or high blood cholesterol levels, diabetes, a group of diseases that causes high blood sugar levels, hypothyroidism, a condition in which the thyroid doesn't produce hormones, primary biliary cirrhosis, a disease in which the bile ducts in the liver are slowly destroyed, cholestasis, a condition in which the flow of bile from the liver slows or stops, nephrotic syndrome, a disorder that changes the blood vessels in the kidneys. Illustration 8. Xanthoma on knee. Hematologic diseases. These are genetic conditions that affect the body's ability to break down substances and to maintain important bodily functions such as digestion of fats. Cancer, a serious condition in which malignant cells grow at a rapid and controlled rate, side effect of certain medications such as tamoxifen and others. 2.3. Types of xanthoma. There are many kinds of xanthoma. Some are differentiated based on their color. Others are differentiated based on their causes, and there are some others which are differentiated based on their shape. Tuberous xanthomas. Xanthomas, like a tumor, are a collection of foamy histocytes in the dermis. They may be associated with familial or acquired disorders resulting in hyperlipidemia with no underlying medical disorders. Tuberous xanthoma form as yellow nodules and are frequently associated with hypertriglyceridemia, but they are also seen in patients with hypercholesterolemia. Illustration 9. Tuberous xanthomas. We have presented a case of multiple tuberous xanthoma in a subject with normal lipid metabolism and with no associated systemic disorders, which is an uncommon occurrence. This case is being reported because it's a rare occurrence. The aim of this report is to emphasize that the patient has a normal lipid profile. Causes of tuberous xanthoma. All xanthoma are primarily caused by elevated levels of fat in the blood and body. This leads to excessive deposition of fat in tissues, the production of foamy cells, and eventually xanthoma. Here, some factors are responsible for the predisposition of developing xanthoma. Obesity, elevated levels of lipids and cholesterol in the blood are responsible for this condition that result in the availability of fats for consumption by macrophages. Hypercholesterolemia, the elevated cholesterol in the blood, which leads to the deposition of cholesterol crystals in the body, which is consumed by macrophages and clustered as foamy cells and ultimately become xanthoma. Genetic diseases and familial conditions may lead to elevated levels of lipid in the blood and hence predispose to the development of tuberous xanthoma. Symptoms of tuberous xanthoma. Gross deformity. The lesions can look unsightly and are a cosmetic disfigurement. In such cases, patients usually seek help. Painless. The lesions of tuberous xanthoma are not painful and usually resolve after lipid abnormalities are corrected. Hyperpigmentation. The tuberous xanthoma or plaque can lead to increased pigmentation, which causes cosmetic disfigurement. Tendinous xanthoma. Xanthoma are commonly caused by excess lipids in the body which are not metabolized correctly. Tendinous xanthoma are cholesterol deposits in tendons. They appear as enlarging papules or subcutaneous nodules attached to tendons, ligaments, fascia, and commonly affect the tendons of the dorsal surface of the hands and the Achilles tendon. Their presence is a possible clinical sign of familial hypercholesterolemia, high LDL cholesterol levels, and premature cardiovascular disease. Illustration 10. Tendinous xanthoma. As mentioned earlier, they appear as subcutaneous nodules attached to tendons or ligaments. The yellow plaques occur most commonly in the hands, feet, and calf muscles. They are primarily attached to the tendons and are commonly found in the ankle and the extension tendons of the fingers. They may be correlated with hypercholesterolemia and enhanced LDL levels. Plain xanthomas. Plain xanthomas are the flat type of xanthomas which can appear anywhere on the body. However, depending on where they grow on the body, this type of lesions grow due to certain particular causes. So depending on the location of these types of plain plaques, the possible underlying causes can be sometimes identified, but not always. Diffuse plain xanthomas. Diffuse plain xanthoma was first described by Altman and Wickelmann in 1962. It is an uncommon subtype of xanthoma characterized by diffuse plain xanthoma of the head, neck, trunk, arms, and legs. They can develop while having normal cholesterol levels. This type of xanthoma typically appear first on the neck and upper trunk. These lesions are due to a rare type of macrophage dysfunction. The defect results in the presence of an abnormal antibody in the blood called a paraprotein. This kind of xanthoma can be correlated with certain types of cancers, meaning that people with diffuse plain xanthomas can have a higher likelihood of developing cancer. This type of xanthoma can also develop on the neck, face, chest, buttocks, armpits, and groin. Illustration 11. Diffuse plain xanthomas. Eruptive xanthoma. Eruptive xanthomas are red to yellow papules appearing on large clusters over the buttocks, shoulders, arms, legs, or even the whole body. In certain cases, this xanthoma may appear in the mouth as well. Illustration 11. Detail of eruptive xanthoma. These xanthoma are usually tender and can be itchy and sometimes disappear over a few weeks. This xanthoma can be correlated with hypertriglyceridemia and also with diabetes. These xanthoma are small yellowish papules that occur in large numbers in the same area on the body, in clusters, so to speak. They are primarily found on the buttocks, but can also be found on the shoulders, legs, and arms. They develop in small crops and are an abnormal deposition of lipids in the skin. Sometimes these papules can also occur in the mouth and can look like ulcers. Another common feature of eruptive xanthoma that sets it apart from most other types of xanthoma is its ability to cause itch. These lesions can be also tender. It is therefore important to differentiate them from other skin conditions which may not be benign. To summarize, eruptive xanthoma are lesions which typically erupt in groups of small red yellowish papules. Most commonly come up on the buttocks, shoulders, legs, and arms, but might develop all over the body. Benign lesions that rarely develop on the face. Lesions that may be sensitive and usually itchy but benign. Strongly linked with hypertriglyceridemia, increased triglyceride levels in bloodstream, often in patients with diabetes. Causes of eruptive xanthoma. Familial hypercholesterolemia type 2. The disease is caused due to a genetic abnormality in LDL receptor that results in elevated levels of this fat in the body. Broad beta hyperlipoproteinemia caused due to a protein mutation that causes elevated levels of triglycerides and cholesterol, exaggerating the condition. Hypertriglyceridemia, which commonly leads to hypertension, obesity, and diabetes. Elevated levels of fat in the blood may contribute to the formation of xanthoma. Diabetes. The excessive sugar is converted into fats and the tissues are surrounded by an inflammatory reaction that is difficult to control, leading to eruptive xanthoma. Xanthoma in the Achilles tendons. Xanthoma can appear on any part of the body. They are also commonly found in the Achilles tendon. When xanthoma appear on the Achilles heel area, they are found pressing on the tendons underneath the skin. The main peculiarity of this type of xanthoma is that it grows underneath the dermis, whereas most xanthoma are found between the dermis and epidermis. When found on the Achilles tendon, this xanthoma can cause particular discomfort to the patient. The patient may request to have them removed because of the discomfort while walking and running. However, xanthoma are benign and therefore can be left untreated without compromising the longevity of the patient. Sometimes xanthoma in the Achilles heels can keep growing over time if left untreated. The only treatment known to date, apart of dietary and lifestyle changes, is surgery. Surgery for this type of condition is only advisable once the condition becomes too discomforting to the patient. This is because, despite the simple procedure required for this type of xanthoma removal, any surgery presents risks. Achilles heel xanthoma surgery is particularly safe to perform because no general anesthetic is required unless the xanthoma is particularly large. The area affected by the xanthoma is not closed to any important artery. Illustration 14. Particularly enlarged xanthoma in the Achilles tendon. MRI and surgery. As we can see from the below picture, the footwear worn by the patient over time can affect the way the xanthoma develop. Surgery for removal of this type of xanthoma will lead to scarring. This is because of where the xanthoma grows on the Achilles heels inside the skin beneath the dermis itself, and therefore the scar left will be due to the deep incision required for this xanthoma removal. This xanthoma MRI shows clearly how this type of xanthoma develops inside the skin and presses on the tendons, figure A and B. Illustration 16, xanthoma figure A. Illustration 15, xanthomas, MRI figure B. From the patient's MRI figure B, we can see the Achilles heel xanthoma pressing on the tendon. However, there is another xanthoma growth underneath the plantar heel. Given that after surgery the patient will not be capable of walking until the xanthoma underneath the plantar heel has completely healed, the xanthoma should only be removed if this condition becomes particularly bothersome to the individual. The picture on the right shows a large xanthoma removal. The surgeon might decide to perform this procedure under general anesthetic for large xanthoma removal. This procedure will inevitably leave scarring to the individual. Illustration 17. Surgery xanthoma removal in the Achilles tendon. However, the benefits of the surgery far outweighed the small risks in this case. Xanthoma can develop on any part of the body. They have different characteristics depending on the area where it is found. While xanthoma on the Achilles tendons grow underneath the dermis, fortunately, when finding them on other parts of the body, they develop between the epidermis and the dermis. This, therefore, allows possible xanthoma removal without leaving any scar. Illustration 18. Xanthoma on elbow. As we can see, in this particular case, the patient affected is of athletic type and does not have high cholesterol levels due to his physically active lifestyle. The xanthoma have appeared despite of this healthy lifestyle. Xanthoma can also appear on the back of the hands. Removal of this type of xanthoma is possible with lasers, hyfricator, and other similar equipment by superficial ablation. The operator can assess the risks of scarring depending on whether the xanthoma has affected the dermis. As stated earlier, with the exception of planar xanthoma, including Achilles heels tendon xanthoma, xanthoma develop superficially between the dermis and the epidermis. Illustration 19. Xanthoma on hand. Normally, an experienced dermatologist can assess the risk of scarring by looking at the lesion. The rule of thumb to follow in order to assess the risks of scarring after xanthoma removal procedures is that the more superficial the lesion, the less the risks of scarring. In case it is not possible to see the corrugation on the lesion, this means that the lesion could have grown deep into the skin and maybe underneath the dermis, but fortunately this is very rare. Therefore, a deep incision is rarely required to remove the xanthoma, and a simple superficial ablation will often suffice. This case is not only a further demonstration that xanthoma can appear anywhere on the body, but also can be developed by individuals that are neither overweight nor have high cholesterol levels. Xanthoma removal of this type is normally successful by simply using superficial ablation. However, given the extent of the area to be treated, a number of sessions to achieve complete removal may be required. By all means, it is possible to remove all xanthoma from such a large area in a single session. This main drawback when using electrical arcing or lasers is the relatively large extent of the burns that the patient is subjected to within one session. Such a large amount of burns could pose the body to needless stress, which should be avoided. This further example shows how xanthoma can develop also at a young age. The removal of this type of xanthoma is also sometimes possible by using superficial ablation as well as specialized peels. Illustration 21. Xanthoma on eyeball. Illustration 22. Xanthoma on buttocks. Fortunately, these types of cases are quite rare. This young patient presented overgrown xanthoma on the buttocks. The best proposed removal solution would be conventional surgery under general anesthetic. However, an MRI would be advisable before scheduling surgery. The MRI will provide important information concerning these benign growths inside the patient's body. As we have seen, xanthoma are not only a skin condition. It can grow in the eyeballs and other parts of the body. Illustration 23. Gastric xanthoma. Xanthoma can also grow on internal organs. This is a case of gastric xanthoma found by sheer chance. Of course, this type of xanthoma does not need to be removed as it will not cause any threat. The picture below clearly demonstrates that xanthoma are not a condition exclusive to us humans. Therefore, if you ever develop or you have xanthoma, you know that there is little to worry. Many people have it, and you may even not know about it. How is xanthoma diagnosed? Your doctor or dermatologist can easily diagnose xanthoma if they are trained appropriately. They may be able to make a diagnosis simply by examining your skin. A skin biopsy can confirm the presence of a fatty deposit beneath the skin. During this procedure, your doctor will remove a small sample of tissue from the growth and send it to a laboratory for analysis. Your doctor will follow up with you to discuss the results. They may also order blood tests to check blood lipids levels, assess liver function, and rule out diabetes.